Assalamu alaikum. On behalf of Ahsan Academy, let me welcome you to a presentations on arteries of the abdomen. In this presentation, I will cover the following subjects: the origin of the main artery of the abdomen, origin and termination of the abdominal aorta, and branches of the abdominal aorta. Major arteries of the abdomen supplies the wall and organs of the abdomen and the wall and organs of the pelvis. Some of the arteries directly proceeds to the lower limb and supply the lower limb bypassing the abdomen. The abdominal arteries remain in the posterior wall of the abdomen, and pelvic arteries remains on the lateral wall of the pelvis. Let us see how the artery originates from the heart. You can see the heart in the figure. This one is the left ventricle, and from the left ventricle blood is pumped into the ascending thoracic aorta. This ascending aorta continues and curves posteriorly as arch of the aorta, and at the same level of the origin it terminates and become descending thoracic aorta and descends in the posterior mediastinum. You can see the heart is removed and the posterior mediastinum is exposed. This area is the posterior mediastinum, and this one is the esophagus, and you can see the arch of the aorta curves round posteriorly and become descending thoracic aorta up to the aortic opening of the diaphragm. So this one is the descending thoracic aorta. You can see through the diaphragm opening it enters. Here it is clear that the arch of the aorta is continuing in the posterior mediastinum as descending thoracic aorta. This is the diaphragm. It's a curved structure, and this one is the aortic opening remaining in the posterior part of the diaphragm. So at this opening, the descending thoracic aorta continues as abdominal aorta. So abdominal aorta, this is the site of origin. This one is the diaphragm, and this is the aortic opening, and the aortic opening is situated at the level of the 12th thoracic vertebra. This is in front of the body of the 12th thoracic vertebra. So this one is the abdominal aorta, and at the above uh, from here to here, this is the abdominal aorta, and this one is the aortic opening at the level of the 12th thoracic vertebra. So it originates here and continues in front of the lumbar vertebrae. So thoracic 12, lumbar 1, 2, 3, and at the level of the lumbar 4, this bifurcates into two common iliac arteries, right and left common iliac arteries. So this is the simple course of the abdominal aorta. You can see the diagram of the abdominal aorta and shown the origin as well as course, means all the vertebral bodies are visible here. You can see the diaphragm and on right crash and left crash of the diaphragm too. These are the vertebrae, and intervertebral disc is in between them. So let us see the branches. So this is the opening, aortic opening at the level of the 12th thoracic vertebral body, and it extends vertically downward up to the lumbar 4 and ends as two terminal branches, right and left common iliac arteries. This has several branches who are arranged in three sets: anterior sets, such as ventral set, lateral set or side branches, and posterior branches or dorsal set of branches. So we will try to maintain the sets. The previous one, which we have said already, this is the terminal branches. These two are the terminal branches, right and left common iliac arteries. This one is the inferior phrenic. This one is the middle suprarenal. These four arteries we can see, four pairs of artery. This is 1, 2, 3, 4. First, second, third, fourth pair of lumbar arteries. This is left first, left, right first, second, right and left. So in this way, lumbar arteries are arising from the side of the abdominal aorta. This one is the gonadal artery. So gonadal artery means for the male it is testicular artery, and for the female it is ovarian artery. So all these are the lateral branches of abdominal aorta. Let us label on the left side. This is celiac trunk. This one is the superior mesenteric artery, and this one is the inferior mesenteric artery. So these are the ventral branches of the abdominal aorta, and these arteries are actually the arteries of the gut. So it supplies the derivatives of the gut. The last one below is the median sacral artery, and it arises from the dorsal surface. So this is the dorsal branch of the abdominal aorta. So abdominal aorta has four sets of branch: the terminal branch, the lateral branches, the ventral branches, and the dorsal branch. Let us discuss one by one. You see, this one is the abdominal aorta, and branches are shown here. So let us label it. The first one, the ventral branch, is the celiac trunk. So this is the artery of the foreguard derivatives, means it is supplying the esophagus. Actually, lower part of the esophagus is supplied by this stomach, liver, gallbladder, pancreas, and proximal part of the duodenum up to the major duodenal papilla. It also supplies the spleen. So let us see the branches. It is arising close to the uh, origin of the abdominal aorta. So the label is 12 thoracic vertebra. It's a very short artery, usually close to the 1 centimeter size, maybe as long as 3 centimeter. Then it divides into three branches: the left gastric artery, this one is the splenic artery, and hepatic artery. The left gastric artery is relatively smaller and distributed to the lesser curvature of the stomach near to the lesser curvature. And splenic artery goes to the spleen, and in the OA it supplies the pancreas and also to the duodenum. Hepatic artery mainly going to the liver and supplies the pancreas, supplies the liver as well as gallbladder, and also supplies the artery to the proximal part of the duodenum. So you can see this is the stomach, and the branches are shown here. This is the left gastric artery going to the lesser curvature, supplying branch to the fundus, towards the fundus, close and body and pyloric part near the lesser curvature. This one is the splenic artery going behind the stomach to the spleen. On the way it is supplying the pancreas. This is the hepatic artery going to the liver, supplies the gallbladder, liver, and give a small branch to the stomach and proximal part of the duodenum. This one is the pancreas, and this one is the spleen. Superior mesenteric artery, you can see just ventral branch. Second branch is the superior mesenteric artery, and it supplies the derivatives of the midgut, means small intestine except the proximal part of the duodenum, means below the mesoduodenal papilla, small intestine, other parts, large intestine up to the proximal two-thirds of the transverse colon. You can see this is the proximal part of the duodenum. So the distal part is supplied by, this is the superior mesenteric artery giving branch to this area, and this artery actually arises from at the level of the lumbar one, and it enters into the mesentery. I will show the figure. This is the inferior pancreaticoduodenal artery, and superior mesenteric artery continues. You can see this is the superior mesenteric artery entering into the mesentery and gives multiple branches to the small intestine, also to the large intestine up to the proximal two-thirds. This is the superior mesenteric artery, and these are the branches to the jejunum, and passes from the root towards the jejunum through the mesentery, and these are the ileal arteries, and this one from the proximal part gives the ileocolic, supplying the terminal part of the ileum, cecum, vermiform appendix. This is the right colic supplying the proximal part of the colon, means ascending colon, and you can see this is the right colic branch, and here this is another branch. This is the middle colic artery, and this middle colic artery supplies the transverse colon up to the proximal two-thirds. Third ventral artery is the inferior mesenteric artery, and it is the artery of the hindgut, means distal part of the transverse colon, means distal one-third of the transverse colon, descending colon, sigmoid colon, rectum, and extending up to the upper part of the anal canal. You can see this origin. This is the third part of the duodenum, the lower margin of the origin. This third part remains at the level of the lumbar 3. So this artery arises here at the lower border of the third part of the duodenum, actually behind the lower part of the lower border of the third part of the duodenum. This one is the inferior mesenteric artery. You can see this is the inferior mesenteric artery giving branch to the colon, means distal one-third of the colon. Then this is the descending colon, sigmoid colon, going to continue as the rectum that cannot see. So this one is the left colic artery, this one is the sigmoid artery, and this one is the superior rectal artery. So with these branches, the inferior mesenteric artery supplies those areas. Now individually, I'll try to cover some major areas. The suprarenal gland has three sources. You can see this is the inferior phrenic artery, which is the branch of the abdominal aorta. Uh, this gives series of superior suprarenal arteries. The second one is the middle suprarenal gland, suprarenal artery, that runs towards the suprarenal gland, and it is direct branch from the abdominal aorta. Now you can see this is the left renal artery. Simultaneously there is right renal artery. This renal artery gives the inferior suprarenal artery. So three sets of arteries. Superior suprarenal artery are multiple, and one middle suprarenal artery from the abdominal artery, and another inferior suprarenal artery that arises directly from the left renal artery. The renal artery is the very large artery arising from the side of the abdominal aorta at the level of first lumbar vertebral body, runs laterally in either directions to the right and left. The right one is longer and passes behind. You can see it is passing behind the vena cava. This is the vena cava. Then it is going to behind the, it is the vein, it lies behind the vein, and duodenum lies here, so behind the duodenum and head of the pancreas. So you can see this is the duodenum and this is head of the pancreas. So the renal artery lies behind the duodenum and head of the pancreas. It lies in front of the, this is the psoas major muscle, in front of the psoas major muscle. The left one is relatively shorter and it passes posterior to the vein. This is the left renal vein, and pancreas, this part is the body of the pancreas, and it extends up to the, this is the spleen. So the vein arising from the spleen passes with the splenic artery. So this splenic vein lies in front of, this figure is not showing here, in front of this renal vein, renal artery. Gonadal artery means testicular artery for the male and ovarian artery for the female. So these arteries are long cylindrical artery, goes to the respective area to supply. So this remains very longer artery and arises just below the renal arteries at lumbar 2 level, usually maybe as high as lumbar 1. This goes to the testicles or ovary. The lumbar arteries, we have already discussed that, say, 4 lumbar arteries are there arising from the lateral side of the abdominal aorta. A fifth pair is there that arise from the median sacral artery. So this fifth pair is relatively smaller than other 4 pairs. This is the median sacral artery. So this is the posterior branch of the abdominal artery. This is a smaller branch, arises close to the termination of the abdominal aorta, just little above the bifurcation from the posterior aspects. This median sacral artery arises. Pelvic arteries. The arteries proceeds into the pelvic cavity. So this is the pelvic cavity, and this one is the pelvic cavity from abdominal part. The inferior mesenteric artery, already we have discussed that continues into the pelvic cavity as superior rectal artery, but the major supply is this is the bifurcation of the abdominal aorta. It goes to the right side and left side as common iliac, and in front of the respective sacroiliac joint it divides into external iliac and internal iliac. So external iliac proceeds into the lower limb. So this one is the common iliac, and this is the internal iliac that enters into the pelvic cavity. External iliac proceeds into the lower limb. You can see this internal iliac giving series of branches in the lateral wall of the abdominal cavity to the pelvic organs and the wall. This is the external iliac artery. And a small artery, the median sacral artery, also supplies the wall of the, you can say this is the rectum, and behind the rectum lies the superior rectal artery that divides into two to proceed on either side of the rectum. So the principal artery to the upper third of the rectum is the rectal artery. You can say this is the inferior mesenteric artery continuing downward and runs behind the rectum. This is the behind the rectum, divides into two and makes plexus behind and the rectum, and anastomosis with the middle rectal and inferior rectal artery to supply the rectum and upper part of the anal canal. The internal iliac originates in front of the respective sacroiliac joint as the terminal branch of the common iliac arteries. You can see this is the common iliac artery, origin as the bifurcation of the abdominal aorta in front of the fourth lumbar. Then it goes downwards and downwards towards the respective sacroiliac joint. In front of the sacroiliac joint, it divides into, this is the external iliac, continues to the upper lower limb, and this is the, you can see this is the internal iliac artery. So internal iliac artery goes downwards into the pelvic cavity in front of the sacroiliac joint to the upper margin of the sciatic. Here is the sciatic nose. So in the small part of the lateral wall of the pelvic cavity is there, that is the internal iliac descends through. Then it divides into anterior posterior branch. You can see this is the anterior branch and this one is the posterior branch. This one is the anterior division and this one is the posterior division. They supplies the pelvic viscera, perineum, pelvic wall, and through the sciatic foramen it enters into the buttock to supply the muscles of the buttock. You can see this is the anterior division of the internal iliac and it gives a series of branches in the lateral wall. I'm showing and labeling these branches. This is the middle rectal artery going behind the rectum, anastomosis with the superior rectal artery to supply the rectum. This is the inferior vesical artery. Vesical means the bladder, so it is going towards the bladder, urinary bladder. This is uterine artery, present in case of the female to supply the uterus. This is the umbilical artery, which runs and gives the superior vesical artery. So this in embryonic life this is very important artery, but in adult it is mainly forming the superior vesical artery to the urinary bladder. This is the obturator artery. It goes through the obturator foramen to the medial side of the thigh to supply the medial side of the thigh. This one is the ovarian artery, as it is a female, and it enters into the pelvic cavity, and the ovary is a pelvic organ and it is supplied by the ovarian artery. This is the direct branch of the abdominal aorta. It is not branch of internal iliac. The posterior branch, you can see this is the internal iliac giving the anterior branch. It is going in the posterior, descending in the posterior lateral wall of the pelvis up to the sciatic foramen. Here is the greater sciatic foramen. This is a posterior division and it gives several branches to supply the pelvic wall and the buttock. Thank you very much for remaining with the presentation.